Good morning, everyone. I'm Amy Allen, Vice President of the Westchester County Association, and it's my pleasure to welcome you to the latest episode in our Business Insight series, produced jointly with West Fair Communications. These Business Insights programs are meant to bring you programs on timely and topical issues. Certainly, the impacts of COVID-19 have been extremely timely and topical, and our last few episodes have focused primarily on those. In fact, last month, we brought you a program on the rollout of the COVID-19 vaccine, and today's program is going to address the significant mental health impacts that we are all facing as a result of the pandemic, and specifically what employers can do to help their employees navigate through some of these issues. But before we get started, I would like to take a moment to thank our Platinum partners, without whose support we could not bring you programs such as this. So it's now my pleasure to introduce our two distinguished guests. First, we have Ariana Georgatos, Human Resource Manager for Grassi's HR and Organizational Development Service. I promise you, Ariana is here live with us. She was having a little bit of technical difficulties with our video, but you'll be able to hear her, and she is excited to join us, and we're happy to have her. And our other guest is Dr. Joanne DeFede, who is a professor of psychology in psychiatry at Weill Cornell and attending psychologist at New York Presbyterian, and she's also the director of their program for anxiety and traumatic stress studies. And as an experienced practicing clinician, Dr. DeFede will certainly be able to speak to the many mental health impacts related to the pandemic. So let's get started with our conversation. One quick housekeeping note: if anyone in the audience has questions, please feel free to submit them in the chat box alongside your video, and we will certainly get to as many of these as possible. We do want to keep this conversational and have a lot of Q&A back and forth. So to set the stage, I'm going to turn to Dr. DeFede and ask her to tell us a little bit about what she's been seeing with her patients throughout this past year.
Yeah. Good morning, Amy, and thank you for inviting me to speak with your group today on this important topic. I think it's important to step back and recognize that we are all under tremendous stress. And some people are under more stress than others because of the nature of their work and their personal living circumstances. And to set the stage, it's all brain-based, and people will talk about, oh, I should do better. I feel guilty. I'm not doing more. But the fact of the matter is that our brains are wired when we perceive a threat to our life to fight, flee, or freeze. And then the coronavirus is a novel threat. So we all are experiencing that threat. And on a milder form, people talk about having difficulty concentrating. Even people who love to read will say, I can't read anymore. I can't concentrate. I'm not sleeping as well. I'm more anxious. All the way to developing certain psychological or psychiatric syndromes that are associated with trauma, such as post-traumatic stress, which our frontlines workers are more at risk for, depression, anxiety. And so that there's a full range. Most of us will be able to use, as horrible as this is, and some people liken our current circumstances to a war zone. So as horrible as it may be, most of us will figure out a way through it, and our adaptive coping resources will kick in. One of my professors, who was a concentration camp survivor when he was a child, and taught the stress course, would talk about the miracle of health and how people lived through horrible circumstances and were undoubtedly changed by them, but somehow went on to live full and productive lives. Um, some of us will need help, and there's everything from self-help uh, to non-psychological means of help that are important for our brains and our bodies, like exercise, to professional help. The important thing is if you're feeling out of sorts and it's been going on a while, that you consult with a mental health professional or your primary care provider and talk with them about how you're doing. And if you're not doing well, let them have a conversation with you about what makes sense for you. Do you need professional help? Will self-help resources be sufficient? Will other non-psychiatric or psychological forms of help be the way to go? I know we're talking through a lot of HR folks in the audience. A lot of this work is being done now at EAPs, where there are a range of resources. And so I would encourage people who are listening, if you're having any problems, to consult, again, your primary care provider, as you would do it if you had a cough, do it for your mental health, and your EAPs. Couple of things to note here is that all of our lives have been disrupted, and we've all attempted to find new routines. Um, it's important to come up with a routine, stick to it. It's important to do simple things for your mental health that may seem so simple that they don't matter, like actually get dressed for work if you're going to work. I have some 20-somethings in my children. One of them said, "Well, we finally realized that we should get out of our PJs for our classes and actually feel better." Go to another place. To do your work, exercise. If you don't exercise now, maybe start simply. Again, if you're not in shape, you might want to consult a health professional, but take a walk, uh, um, develop a consistent sleep routine. All of these things are really, really important because the effects of stress are pervasive. They affect us physically, our brains, our hearts, our stomachs. So people have all sorts of stress related problems that are amenable to everything from exercise to medication. There's a cognitive effect of stress. We worry more, we have difficulty concentrating, we may be more indecisive. Um, Again, talking to friends and loved ones may be enough for you, but if not, get some help. The emotional effects are anxiety, which is very understandable. We're all living under constant threat and fear. Um, Guilt is very common, and shame. I should do more. I shouldn't be upset with my children. I should be the same person I was to my at work and be able to concentrate as well, get as much done. Interpersonally, we're more irritable. That's a normal stress response when your brain is ratcheted up to prepare to fight or flee or freeze. Then your body's creating chemicals that are likely to make you more irritable and have more difficulty concentrating. But that leads to more family conflict at work, angry outbursts, and as we saw, if you read today's New York Times, more domestic violence and other problems like that. Um, But again, I want to emphasize that most of us, I don't want to pay, we're living through warlike conditions, but nonetheless, people will get through it. Uh, um, and just to reiterate, things to watch for are routines, keep to a schedule, develop a sleep ritual if you haven't already done that. If you don't exercise now, just walk around the block as a way to start. Your what you eat, your nutrition matters. If you don't know what to do, you might be able to go to your EAP or talk with your primary care doc. Support, whether you're an extrovert or an introvert, is really important. I know extroverts are complaining that they're home and they're just not getting the social connection they used to get. And then introverts talk about, maybe being more isolated and having too much time to themselves than they wanted. And so finding ways, there are all sorts of ways to address these issues from the workplace to home. And it's important to keep vigilant on that. Finally, though, one of the things that I keep referring to this being warlike, we're living under unprecedented times. We're probably all tired of hearing that expression. Um, Probably one of the most important things we can do as individuals and as family members and friends is to accept it. It's not, we're all still trying to change our circumstances, or many of us are, change the circumstances. But I think we're at the point where accepting is really important, and there's a lot of data that shows accepting is the beginning to finding a new path and a better physical and mental health state. Simply naming your emotions is important, even if you can't change them. And it may seem way too simple given the circumstances we're under, that simply naming that, oh, I'm scared, I feel hopeless, would help. But data shows it does. Because we think that it's such an extraordinary set of circumstances. We're living in like a war zone, that simple things don't help. But over time, enough of them together can help us cope a little better. It doesn't mean you're going to return to your pre-pandemic life or state of mind, but it will help you get through these really extraordinarily difficult times a little more easily. Amy, I could go on, but I don't know if you want me to stop. If I'm at about my 5 minutes, and then we can talk more for questions.
Sure. So thank you, and you're certainly painted quite an accurate picture. I'm sure everybody listening and watching has experienced at least one of the things that you've mentioned. And I know we want to focus on how this is affecting employees and employers. I mean, there's been many studies that even before the pandemic, the loss in productivity to employers from anxiety, depression, other mental health conditions from their employees is significant. Now, given the pandemic, it's ratcheted up. So, Ariana, I'm gonna pivot and ask you, what are the things that you're hearing from some of your employer clients? What are they coming in and asking advice on, or telling you that they're seeing among their employee population?
Thanks, Amy. That's a great question. So, some of the things that we're hearing and seeing from employers at this time are issues surrounding employee morale, employee retention, job satisfaction, people feeling fulfilled at work. It's very common now that people quite literally feel like all they're doing is working, eating, and sleeping. And that is the routine, as Dr. DeFede mentioned earlier. And that is not exactly a healthy routine, both physically and mentally. And I think it sounds so simple, but we're all kind of stuck in that right now. So I think last year we were seeing that at an extreme height, kind of in like the April, May, June months, when things like had just really came, kind of exploded in March. Those first couple of months were very difficult for a lot of our clients. It also depended on what industry they were in. The economic climate and the way that things were so erratic, and company successes and failures. It was very interesting because it almost depended on what industry you were in, what kind of business you were providing, what services you were providing. That all depended and, kind of tended to the success of the business at that time. So there's so many things happening for leaders. There's so many things that employees are feeling, and then we also were seeing we were being asked a lot of the time to handle furloughs, mass terminations. And, that's difficult for the employees who are terminated. And it's also difficult for the employees who are left behind and still work there saying, am I next? They're going to work with fear. They're concerned, they're stressed. And like Dr. DeFede said, that can weigh on you physically and mentally. And then people are just not feeling good at all. They're not satisfied. They're scared. There's so many elements to it. And aside from that, we also saw a lot of the time, we were providing advice and assisting with issues related to the Families First Coronavirus Act, whether we were helping employers deal with people who contracted the virus, people who were caring for family members that contracted the virus. There's so many components and things that we have been able to help employers with, but those are the most prominent, that stand out to me.
Thanks. And Ariana, Dr. DeFede mentioned EAP programs that many employers do have in place. Have you seen an increase in utilization of those, and EA employer assistance programs, for those who don't know what EAP programs are? And I mean, they've been a staple of many employers' benefits packages. So, Ariana, I was just wondering if they've been increased or more utilized.
Yeah, another great question and point. So it's so funny. I wrote that down actually as another note for one of the other questions in preparation for the program. And, we have seen it actually for ourselves as a business. We keep reminding our employees actually that we have an EAP available to them and what that constitutes, because people hear it, see it, they don't know what the acronym is and what's available to them. So we actually, as a business, as a firm, we keep reiterating that to our employees. And I will say that we also do see employers offering that, and kind of, if they didn't have it before, they most certainly have one now. And what does that mean, right? So that could mean a number of things. It could be corporate counseling. It could be family assistance, dependent assistance, childcare assistance, flexible work arrangement. It could mean so many things. So that is very important at this time. And we have been encouraging clients, if they don't have something like this available to their employees, they really should.
Great, thank you. So here I have a question. Actually, I'll address it to both of you. And just a reminder to our audience that if you have any questions, please write them in. We've heard from some of our members that obviously PTO, paid time off, is an important benefit for everyone, and often that was used to take vacations, to go away. People would book a week somewhere. People aren't traveling now, but some employers are kind of having what they call enforced PTO, requiring employees to take a day, 2 days, disconnect from the grid for work, and just take, the proverbial mental health days. So, Dr. DeFede, for clinically, is that a good thing? And then, Ariana, are you seeing more employers kind of trying to get their employees to disconnect a little? So I'll ask you first, Dr. DeFede. Clinically, what do you think about that?
Well, a change in routine is good for our mental health. The difficulty, as you pointed out, is that we can't go anywhere. So while people talk about taking, some people find benefits in it and can use the time to do other things, and other people find it more stressful. But on balance, though, I would recommend that everyone take some mental health or vacation days, and try to plan an activity that is possible with yourself, your family, your friends, depending upon your living circumstances, whether it's going to the park or something you don't usually do, or taking a drive and whatever is possible that's a little different for a day or two is advisable. And just get out of your current circumstances.
And Ariana, are you seeing more and more employers, or maybe even your own firm, trying to enforce that?
Thanks, Amy. Yeah, so I'm going to use my firm as an example here. So for those of you who don't know, the Grassi HR consulting business is a part of Grassi & Company, which is a public accounting firm. So public accounting can be a very time-consuming and life-consuming industry. So we strongly encourage our employees, when we're outside of peak busy seasons, which can be a typical tax season, or for those who don't know about audits, it's typically earlier in the year depending on industry. When we are outside of those busy seasons, we strongly encourage our employees to take time off to relax, recharge. We suggest that they don't answer emails. It's really easy to just answer emails from your phone these days. I find myself, even on days that I'm supposed to be off, kind of checking in on my inbox and, saying, oh goodness, I have 50 emails, and should I just take a peek at them? So, it's really a difficult thing to kind of disconnect. And it's funny now, like Dr. DeFede mentioned, where are we going, right? We're so limited on travel. So a lot of people are turning to staycations, which don't really feel like a true break in the routine. But we are encouraging employees to be truly off when they are taking PTO. And something we're really proud of this year was that we recognized last year that our employees may not have been able to take as much time off as they have in previous years, or years where there weren't COVID-19. And so we allowed for an extra rollover of an additional 3 days for them to take some PTO that they left behind in 2021. And we were really proud of that, because we felt that the employees we recognized for them that they weren't able to get the time off they deserved. So that's just something additional that we were able to do for them this year.
Yeah, that's a good suggestion. Dr. DeFede, a question for you. Obviously, the whole virtual telehealth, televisits have ratcheted up during the pandemic. I guess, behavioral health can lend itself to virtual visits, but I guess my question is, are they as effective, and do they increase the feeling of isolation? Now if you can't see your provider.
Sure. Well, we knew before the pandemic, there's a lot of data showing that psychology and psychiatry and behavioral health could be effective for a whole wide range of mental health issues. And so we don't generally doubt the efficacy. It works. And we knew that before going into this. That's the good news. And so I would encourage people to use the service and not worry as much about whether it's going to work because it's over some sort of video link. Does everyone love it? No. I mean, a lot of people say they would prefer to be in person, but that doesn't seem to affect the bottom line, which is helping a person get better from their current state. In terms of increasing your social isolation, I haven't really heard anyone say that. I think just the interpersonal connection improves it. And for people who are isolated, and isolation, by the way, if you're living alone and you're more of an introvert or an extrovert with, living by him or herself, actually is really associated with higher rates of anxiety and depression. And so you might be better off having a connection to a therapist than feeling isolated. Not you might be better, you would be better off. And at this point, I want to remind people, don't discriminate against your brain. There's a big stigma around mental health. I hope with the pandemic and the number of people who are, asking for mental health, that is finally put to rest. But until then, don't let it be an impediment to taking care of yourself. If you had a cough, you'd probably go to your doctor if you had it for more than a few days. If you're feeling anxious and not sleeping, or depressed and having difficulty concentrating and just go ask for help, whether it's your EAP or your primary care provider. And to employers, I want to remind you that beefing up your services is a good idea. I mean, the cost of disability for even a couple of employees far exceeds the actual cost of the EAP programs, generally speaking. And I know you all, I'm saying that because there is a reality here. We're in economic crunch and everyone's worried about money. This is a good way to spend it. And I know if you're here, you care about your employees. And so this just, improving those services or augmenting them would be just one more way to show that you're concerned about their welfare and wellness and well-being.
Yeah, thank you. Good, very, very good point. So that, Ariana, speaking to that, how far can an employer go in terms, if they sense that they have an employee who's struggling, but they haven't asked them for help? I mean, how, with privacy, and can an employer how far can they go in suggesting some assistance to an employee?
So in those cases, Amy, there may be a situation where maybe a team leader, a manager, someone comes to us and says, look, I recognize this person seems to be having a difficult time. Would you mind meeting with them if they haven't done something like that already? So that might be kind of a basic suggestion for us to touch base with the employee. And interestingly enough, some of the things that we were doing.
Okay, I think we might have had additional little technical difficulty, but I understand we do have a question from the audience. So if you want to put that, I guess this is really more of a question for Ariana. So when her technology works, I'll make sure she gets it. Are you back with us? No. Okay. So Dr. DeFede, let me ask you a question. So there has been a lot. Pre-pandemic, there was a lot of talk and legislation about making sure that mental health treatment was, on
There
parity
is
with.
A situation where. Are you able to hear me?
Yes.
Sorry, now we can. Yes. So, Ariana, there was just a question posted from our audience about how simple is it to set up an EAP, and how do they do it? Should I just tell them to contact you and you'll help them? How does that work?
Yeah, that's definitely something that we can address offline. We do work with benefit providers to see what type of assistance programs and the types of assistance that we can help employers make available to their employees. Again, it's a very customized thing, but I'm definitely happy to assist with that. Have a discussion further after
Great.
this event.
Great. So I think before we lost you, you were commenting on something. Do you recall what that was, or should we can just move on?
I'm not sure if you were able to hear my whole commentary about employee check-ins. Actually doing them as a habit. And what I was saying is that if you do it at random, if there is a situation with an employee, they could feel scared or nervous. Like, everyone gets that, HR is calling me type of thing, which I hate that stigma. 9% of the time we're calling to check in on you, see if you're doing okay. Of course, there is a portion of times where we're calling people and, reaching out to them because we are going to proceed with the termination or there's some type of problem. But again, keeping those employee check-ins right now as a part of the routine, that also will help if there is a situation that someone's experiencing either in their personal or professional lives. Maybe they're struggling with something. Again, that's kind of a very basic way to connect with them and say, how can we help? We're here to help. What I've learned about being an HR professional is we are quite literally here for our people. And I think that they need to see us as a resource instead of someone who's monitoring them. And I think that that's actually an interesting thing. And I'm continuing to learn that over time as I grow in HR, professional.
That's a great point, and hopefully, people now are more willing to ask for help. We can only hope. In fact, the question I was posing to Dr. DeFede with the requirement now that mental health treatment is considered, on parity with medical treatment and appointments. Are you seeing people take advantage of access to mental health providers more than in the past?
Yeah, parity is long overdue, and it's taking a long time for, I think, our culture to take advantage of that parity because of the stigma and concerns about confidentiality and will I be discriminated against? Will people think I can't do my job if I seek mental health intervention? So to go back, before I go further into depth about that, I wanted to double back to what Ariana was saying and say that I think that check-ins are a great idea, and making them routine across all departments is really important right now. Leadership, the message that leaders give from these check-ins or about the check-ins is crucial to getting people to use their medical benefits and access mental health services when they need them, or when they're not sure and they need to just get a consult about what they need. And so I encourage all leaders to think about your stance on mental health and what you say to your employees about it. Chances are you probably don't say anything, and now is the time to change that and to come out and recognize that the brain is as important as every other part of our body. We shouldn't discriminate. We should we should implement our mental health benefits and let people know that we won't hold it against them if they do. And I would also say to employers that now is also probably the time to bring in some outsiders from the medical behavioral health to talk to your managers and talk to your employees. And we find that facilitates people actually beginning to use services as well. But to go back to your specific question, that the average number of treatment sessions is 0. Most people don't seek mental health treatment still, which is why this activist approach of getting HR people and then mental health professionals to go into organizations and talk to them and encourage use while stressing the confidentiality is essential.
Ariana, you're here in person. Welcome. Just one other issue, and I'll start with you, Dr. DeFede, as well. The whole area of substance abuse and the increase. I mean, I saw some statistic that I think more people died from, either accidental or intentional substance overdoses last year than ever before. So, what are you seeing? And then I'll ask Ariana, are there specific resources for employers regarding that? So, Dr. DeFede, if you can just kind of touch on that.
Yes, you hit on a very important point. The use of substances has increased dramatically. That's actually predictable for trauma. There's a very, very high rate when people experience a threat to their life. The rates of depression, as well as just the trauma syndrome itself, and then alcohol and substance use go up a lot. In some studies, it's about half. Why? Well, I mean, using medicines and alcohol in the short term may calm a person down. And if you're listening to this and you find yourself, having an extra drink, or if you're using recreational drugs, or perhaps using your prescriptions not in the way they were intended, that's a perfect time. Today is the day to make an appointment with a healthcare provider and talk with them about it and learn other ways to deal with your anxiety and depression. So, for example, if you're depressed and you're self-medicating, if you go see a psychiatrist or primary care doc, maybe that they'll put you on medication, and that will help you feel well enough that you stop having that extra glass of wine or that extra drink. So it is a very pervasive problem that we need to address up front.
Yes, thank you. Are you seeing more employers ask about assistance specifically with substance abuse programs?
We haven't seen that too much, to be honest with you. But again, that doesn't mean that it's not happening. It might just be that our set of clients isn't experiencing something like that. But that is something that, again, I think it ties into our conversation earlier about, I know Dr. DeFede mentioned this as well, leaders, managers, executives, just the people that are kind of running a business. It's their responsibility to monitor their employees also on a level of care, saying, is this person okay? Is there something off? Should I reach out to them? That's kind of the first step to all of this, and seeing if there is someone who's having this type of issue or concern. Again, and the other side of it is if they're not showing anything like that, is if they're going to come forward on their own, like she mentioned as well, and seek that help. I think both things are very important right now.
Thank you. So we're coming to towards the close of the show. So I just wanted to ask each of you, and I'll start with you, Dr. DeFede, if you have any closing comments. I mean, this has been extremely helpful, and I think we can all identify with what we're hearing. So anything you'd like to leave with us?
I think I've already said it, but it bears repeating. Don't let the stigma about mental health be an impediment to getting a consult. You may not need more than that. It may just be reassuring to hear from someone that actually what you're experiencing is kind of a normal stress response. And if it's not that and you need help, there's help available. There are a lot of very well qualified people in the New York metro area. We're all lucky to live in an area that's so resource rich, although most mental health professionals are pretty busy these days. I would really, really encourage you to use your benefits and do a consult as you would for any other medical condition. Bottom line.
Thank you. Ariana, any final thoughts from your end?
Thanks, Amy. Yeah, so I think just a couple of reminders in this pandemic time that we're living in for employers especially. Transparency is key. Communication is key. Your employees will really appreciate you keeping them in the loop as much as you can, showing that level of concern, making them feel appreciated. There's so much we can do to help our employees have a good experience at work, especially when things in the world are so unknown. I feel work is something that we can keep concrete and objective. So just anything like that you can do for your employees, keep doing it, and remember to be transparent and constantly in communication with them, and offer them as many resources as you can.
Great. Well, I want to really take this time to thank both of you. I know you're both very busy, and this is such an important topic, and we'll make sure that folks know how to reach out to you. And so, Dr. DeFede, thank you again. Ariana, thank you. Technology issues, everything worked great. And as we do with all of our virtual programming, this program will be available on demand through our Facebook and LinkedIn and YouTube channels, and we'll make sure everybody gets those links. All right, well, thank you again to our Platinum partners. Obviously, we greatly appreciate their support. And thank you to everybody who's tuned in. I hope you found it as helpful as I did. Again, we will be back to you in the near term with additional programming, and everybody stay well. Thank you.
Thank you.